OTs. They don't have hygienists. All they do is straighten teeth. Like I said, don't count on a lot of handpiece repairs from an orthodontist. They usually run one slow speed without water. Do count on slow speed repairs from orthodontists. They use a lot of slow speeds. And they usually use a standard dental chair with somewhat of a rudimentary delivery system with a one handpiece line and a syringe coming off of it. The radiographics is your meat and potatoes in orthodontics, gentlemen. Radiographics, meat and potatoes. An orthodontist is nothing without his x-rays. Nothing without his x-rays. He cannot make a move without his x-rays. That's why radiographics are extremely important. If you have an orthodontist that's a good customer or you think is going to be a good customer, I'm having a problem with my pan. Tom, can you, and I've got patients scheduled. Can you help me? You get over there and you help that man because they always have x-ray problems. Orthodontists always have vacuum pumps and air compressors too, okay? Although the air compressor and the vacuum pump is not as critical to an orthodontist, they can work without it. Some orthodontists I know cut their vacuum pump on twice a year because they're not doing anything bloody or invasive, okay? It is very, very important to maintain a good radiographic relationship with your orthodontist. Believe me, if you can fix his x-rays, you have got him as a good customer for both of the rest of your professional careers, hands down. You can fix an x-ray for that man, he will love you for it and be devoted to you, and you will have a great customer. Also, some of your older orthodontists haven't went digital yet, and probably won't. 98% of your x-ray problems are darkroom related. We have another business opportunity. We have another viable business opportunity in this because we can repair processors, we can check dark rooms, we can check solutions, and we can also sell that man digital, upgrading. So with an orthodontist, just because you can't, he doesn't hand you 10 high speeds to fix every time you walk in there, don't feel slighted. He's really opening a door for you that you could drive a Mercedes dual through. A great business opportunity. Great, great, great business opportunity. And it's one of the most expensive and most highest paid parts of the profession. And they actually have the lowest overhead. They actually have the lowest overhead. Okay? Let's move on to endodontics. An endodontist is a dentist who specializes solely in root canals. We've all had a root canal. We've all heard, or we all have relations of somebody that has a root canal. Oh, it's painful. Oh, you don't want to do that. Oh, Lord. It is exponentially better than losing the tooth. Endodontists are people that are very aesthetic minded, very, very scientific and engineering minded people. An endodontist actually works endo means small and continually developing. Endodontists actually, the mouth is small enough to work on, but they're actually working inside the tooth. Using sets of files and so forth, he actually takes the decay out of the entire root of the tooth and removes the nerve of the tooth and replaces that nerve with a thermal filling and preps the tooth and gives it the root canal. And then the patient goes back to the general dentist that referred him to the endodontist to have a crown put on that tooth. Endodontists use high speeds. What a business opportunity we have with endodontists, ladies and gentlemen. They all use high-speed handpieces. Most of them have went to electric high speeds. They all use lights. Most of them use Zeiss optic scopes now that look like a periscope that comes down from a submarine. And most of them have the very best top-of-the-line equipment in the market because they are so fixated on that one small apex that's 2 millimeters in diameter. We have a business opportunity with these ladies and gentlemen with digital sensors that you cannot believe. Digital is the only way for an endodontist to fly because he has to make pictures during the treatment, x-rays during the treatment, to make sure that he hasn't went too far down in the tooth with his file that he's taking the nerve out and debriding the tooth with. Also, the handpiece business from an endodontist is infinitesimal. You will get a lot of handpiece business out of an endodontist. And attachments. Ladies and gentlemen, attachments mean everything to an endodontist. And an endodontist can slap an endo attachment on a standard E-type motor or a standard slow speed and actually make that an endodontic handpiece. A gyrating handpiece, a reciprocating handpiece, left to right, they use extremely specialized handpieces. Business opportunity. Again, chairs, units, lights, x-rays, x-rays, x-rays. When you go into an endodontist's office, be very quiet, be as unobtrusive as possible, speak softly. Speak softly because he is doing even more delicate work than any of the other fields of dentistry. And he depends on quietness. So when you go in there, be professional. Don't throw your tools down. Keep a septic environment. Don't put your tools on the chair. Don't put your tools on the counter. Put your tools on the floor. Clean up after yourself in an endo office. Clean up after yourself always, but especially in an endo office. Endodontists are usually very, very, very easy to work with. They're very exacting in that aspect. You got to consider endodontic treatment is very, very time consuming and has about a 30% failure rate, even with the best endodontists doing it. That's why general dentists refer their endo out. And also, the further posterior you go in the mouth, the harder it is to do the endo, to do the root canal, for obvious reasons. Also, on the upper arch, on your maxillary arch, it's harder to do a maxillary root canal than it is a mandibular root canal, because the poor guy's working upside down and as far back in your mouth as he can. And it is time consuming and it's hard to do right. A good endodontist makes good money just from his referrals. Very important that you be quiet in there, though. I can't stress that enough. Okay? Radiographs, sensors, intraoral sensors. The only thing an endodontist is going to use is an intraoral x-ray. He's not going to use a panoramic x-ray. It's all going to be intraoral. So here we have a business opportunity for intraoral sensors, ladies and gentlemen, okay? The last specialty that we're going to touch base on is going to be pedodontists. Pedo from pediatric dentistry. It's pedodontics. Pedodontists are usually referred to by general dentists. It's a good thing to take a child to a pedodontist first before you take it to a general dentist. In postgrad, the pedodontist actually studies developmental child psychology to understand the mind of the child. They actually love child because a kid can be extremely exasperating in a dental procedure. They actually take the kid in, they show the kid the right way, they'll let the kid ride on their lap, say, hey, let's take a ride in the chair. It's good to do that for a kid. Break them in so that way they have no fear of dentistry afterwards. Like orthodontists, most pedodontist offices are extremely kid familiar and kid safe. Pegboards all over the place, Barney the dinosaur painted on the wall, little gimmicks, little toys to keep them occupied to where they actually look forward to going to the dentist. Pedodontists use handpieces just like everybody else. They use slow speeds like everybody else. They use instruments like everybody else. They use radiographics just like everybody else. They usually use a pedodontic sensor. If you guys will remember from your earlier training, the different sensor sizes. They are highly equipped to deal with kids. Most of them are an open bay concept like an orthodontic office, but they always have a quiet room where if they have a screamer, a kid that's giving them a hard time, they go back in the quiet room, and that way that fear is not contagious to the other children in the office. It's called a quiet room. It's not for punishment. It's not for anything. They actually do the procedure back there. But it's soundproof, so little Johnny's not scaring the pants off all the other patients. A pedodontist can see a child up until the time they're 17 years old, just like a pediatrician can. Until you get too old for them to see you anymore, you can't fit in the chair. Also, you'll see a lot of pedodontists that share an office or in the same facility with an orthodontist. Why? Orthodontist is for adolescents. Pediatrics are for kids. As they grow, they're going to need orthodontia. They have a referring doctor right there. They have one to refer to the other. A lot of pedodontists also have an orthodontic degree as well. Pedodontists are the only way to go with children. Pedodontists use a lot of nitrous to sedate their patients. They use nitrous and use nitrous and use nitrous. So, pedodontics, we're going to stress chairs, units, lights, hand pieces, as with anybody else. A lot of hand pieces and a lot of nitrous repair. So, learn your rubber goods to attach to flow meters. Learn the different sizes of nose piece. There's pedo nose pieces, medium nose pieces. And they'll buy instruments from you as well. And digital sensors. Because kids bite. Kids bite down. They bite through the cords on the sensors and everything. You have recurring sales. You have every one of these is an opening door if you understand the specialty and what the specialist does and how he does it. Easy sales and easy service. It's very important to study up on this, ladies and gentlemen. And if you have any further questions about any of the specialties or any of the interdependencies or any of the interdisciplines between the specialties or governing bodies, please give me a call at any time and I will be more than happy to help you. If you have any questions,